And we are back on the Morning Brew for you on Friday. Happy Valentine's Day. Howie Keibel is with us, co-hosting on the show today. Howie is the community manager for Yelp and a frequent guest on the show. In fact, you'll be a guest here in a few minutes, right?
Yeah, we'll do a segment too.
Okay.
Thrilled to be here.
Howie's filling in for Aaron today. Our special guest on the couch is from the UNM Cancer Center. And Dr. Anita Kinney is with us today. She's a PhD professor of internal medicine and new associate director for cancer control and population sciences at the UNM Cancer Center. Welcome to you, Dr. Kinney. Can I call you Anita?
Please.
Yeah, I will. Thank you.
Thank you. Thank
Great
you for
to have
inviting
you
me.
on. You have an interesting background, and I notice in the notes here that you're a fairly well-known population scientist. I'd like to know what that is.
So a population scientist can come from a variety of disciplines. I'm an epidemiologist, so I focus on the study of the determinants or the causes of cancer, and also how we can treat cancer and also improve prevention and control of cancer. So population scientists typically study the distribution of disease in populations and find ways to prevent and control disease.
And there's so many factors that go into how the way the population lives might have cancer influences and tendencies and so forth. Can you talk in some broad terms about some of the things that you do know about population tendencies and where cancer lives and where it doesn't?
Well, that's a big question.
I know.
That's a very big question.
Maybe.
So for example, there are social determinants of cancer. So people who are socioeconomically disadvantaged or poor
Right.
may be more likely to get certain cancers because of their access to preventive regimens or their use of preventive regimens. Also, they may be more likely to die from cancer because they don't get the access to the care that they need, or quality cancer care
Right.
in some areas. That's not the case in New Mexico. New Mexico Cancer Center treats over 14 or sees over 14,000 people each year, and we take care of about 60% of the population. So to answer your question, there's other causes. There can be environmental causes
Sure.
of cancer, such as exposure to radon.
There could be occupational.
Smoking. So one of the biggest lifestyle risk factors is tobacco use. So people who smoke are more likely to get certain cancers, such as lung cancer. Overweight and obesity is also a risk factor. So there's lifestyle
I see.
behaviors that can actually prevent cancer by maintaining a healthy weight and eating healthy.
And what specifically to New Mexico do you think, can you tell us about what do we battle with or deal with more in this state than on a national basis?
So we have some disparities in our state. We have, for example, colorectal cancer, which is what I'm here to talk to you this morning about. Hispanics and Native Americans, which represent a fairly large population of our state, are more likely to get diagnosed with colorectal cancer at later stage disease. And so that's a huge risk factor for dying of cancer. And so that's a clear disparity. We have other cancers that are commonly occurring cancers, such as breast, colorectal cancer, lung cancer. We have we have an increasing incidence in liver cancer. Hepatitis C may be one of the major factors that's causing liver cancer in our population. So now there's screening recommendations for hepatitis C. So if people get hepatitis C treatment early, liver cancer can actually be prevented.
Now, you and your team are trying to change the whole dynamic here by doing screenings. Is it telephonically or over online, or how are you doing this?
So we just completed a study where it was a randomized trial where we randomized family members of colorectal cancer patients who were not adherent to colorectal cancer screening recommendations to a mailed pamphlet group versus a more intensive intervention, which included a telephone call where they would get a risk assessment and then also receive a counseling technique called motivational interviewing. So we actually got people to think about their risk, to talk about their risk, and come up with their own solutions in contrast to a health educator or a health provider just telling them what to do.
Yeah.
And so we think that's what really made our intervention effective.
Made these conversations more personal, more relevant.
Exactly. It was a personalized risk communication intervention.
Yeah.
And so the individual was the focus, and we worked with each individual to come up with their own solutions and help overcome barriers to screening. Colorectal cancer is actually one of the most preventable cancers. Unfortunately, not enough people are getting screened.
Okay.
Less than 50% of our population, regardless of the risk, familial risk, is
Right.
getting screened. In our study, we focused on family members of colorectal cancer patients because the recommendation for them is to get a colonoscopy. Colonoscopies save lives. So do other types of cancer screening
Sure.
tests. And so our intent was to control cancer in this population,
Does it affect men or women more frequently?
about evenly.
About evenly.
Interesting.
Yeah.
But just by breaking down the whole institutional, formal talking at somebody rather than talking with somebody, it's changed the whole dynamic.
Exactly.
And that's really nice.
It's fantastic.
Yeah, we were very pleased with our intervention, and we actually plan to expand that to in New Mexico through primary care clinics and community health workers, and to train them to deliver the intervention.
Great.
We just submitted a grant to get funding from the National Cancer Institute.
Well, I know that UNM is sort of a leader across the country, one of the leaders in public health studies and their school for public health, right? And sort of working on these things and getting the grant money to really study it.
We don't have a School of Public Health yet. We're hoping to develop a School of Public Health or
But-
College of Public Health here.
But you do study like the environmental factors.
Absolutely.
And doctors learn about populations, New Mexico specific populations, and then are encouraged to go out into the field once they're finished, right?
Right.
Here in
That's a
New
major
Mexico.
thrust in our medical training, which is really unique compared to other medical schools.
Yeah.
Well, we could do a whole show on this.
Yeah.
You know, Dr. Kinney is just an example of the depth of talent that we have at the UNM Cancer Center. I mean, her resume is so impressive, and your work is impressive as well.
Thank you.
Thank you for spending a little bit of your valuable time with us today.
Thank you.
Really
Thank you.
appreciate it. Dr. Anita Kinney with the UNM Cancer Center today. All right, Boris, take us out to break. Special guest named Howie Keibel will be next from Yelp. You don't even have to move. We'll be back in a moment on the Morning Brew.